Okay, so Kim, we talked all about the treatment plan, and I explained everything to you about what we can do, and you've agreed to move forward. And so now what I need to do is I need to make sure that you're consenting to the procedure.
Yeah.
And part of what the consenting process is knowing both the risks and the benefits. We've talked all about the benefits of it, but now I'm going to go over some of the things that you can expect to have after the treatment. And so, basically when we're thinking about what are some of the things that we wouldn't want you to enter into this treatment, I don't want you to be pregnant or breastfeeding. You are not?
No.
Okay. No recent facial surgeries in the area.
No.
And we also wouldn't want you to have any allergies to any of the medications, which you've never had neurotoxins, so you won't know, but we'll be watching for any kind of reaction. So now I'm going to tell you about during the treatment some of the things that can occur. Some of them are just what I like to call undesired outcomes, and some are actually complications that I would want to watch and follow you for. But the first one is that you can get little pinprick bruising where I actually enter in. Now we would never want to treat in any area if you have an active infection in that area. Now I've looked at you and you do not, so you're fine. But you could get from the injection points little tiny pinprick blebs or redness. They can be a little bit swollen, and they could even bruise. And we're gonna watch for that, and I'll tell you if I notice those. Generally speaking, they're self-limiting and they only last for a little bit of time and then they're completely gone. But we'll talk if I see some of those. The second thing is what we call asymmetry. So as the medication enters into the muscle and begins to work, you can get like a bit of movement where it didn't quite get all of the muscle area, and so you'll notice in the mirror at about 5 to 7 days that there's still a little bit of movement in the area. If you see that, we have your follow-up appointment in 2 weeks, and we'll just enter a little bit of the Botox into that area so that then it calms that area. It's just one of the things, we call them asymmetries, meaning that the distribution didn't exactly get all the way out to the end of the area that we're treating. Okay? The other thing that I want to talk to you about is some of the things that can happen that I would want to see you for. So one of the things is that if we're treating up on the frontalis, and we talked about treating high on the forehead, low on the nose, but sometimes people will feel a little bit heavy and they'll feel like their brows are not moving freely. And I want you to call me if you do feel that. It's very rare, given where we are placing it. It should not occur, but I definitely want you to call me if it does. The next thing is what we would call an eyelid pulses or a heaviness of the eyelid. And basically what you would notice is that the change of the eyelid as it moves when you're blinking or just even looking in the mirror. And again, I want you to call for that. But as we talked about where we're doing your treatment today and the way that I'm going to do the treatment, that should minimize that risk entirely, but I still have to tell you about it as part of the consenting process, so I want you to know that you would call me should you ever feel that at all. And then the last part that I want to make sure that I mention is the fact that there are some individuals who are actually non-responders. And it's very, very rare that somebody is a non-responder, and in fact I've never had anybody that completely did not respond to neurotoxin, Botox. And so if that happened, we have in place that we would have you come back in 2 weeks. If you were freely moving, I would choose a different neurotoxin to treat you. And then if it still wasn't working, then I would want to give you your money back. I would not ask you to pay for a treatment that was ineffective. And that is your consent. And if you're agreeable to move forward, then I'll have you sign.
Perfect. Thank you.